Hi everyone, my name is Bailey Spiker and my topic presentation is over child and elder abuse. Starting with the definitions, child abuse is any recent act or failure to act on the part of a parent or caretaker which results in death, serious physical or emotional harm, sexual abuse, or exploitation. And elder abuse is an intentional act or failure to act by a caregiver or another person in a relationship involving an expectation of trust that causes or creates a risk of harm to an older adult. Child abuse has 4 different types. The first 3 include physical, sexual, and emotional abuse. Physical abuse is the intentional use of physical force that can result in physical injury, and that can include hitting, kicking, choking, burning, anything that can cause physical harm to the child. Sexual abuse involves pressuring or forcing a child to engage in sexual acts. A lot of the times they are not getting consent and they really might not even know what's going on. Emotional abuse refers to behaviors that harm a child's self-worth or emotional well-being. That can include yelling and screaming that affects their mental health. The 4th type of child abuse is neglect, and that's the failure to meet a child's basic physical and emotional needs. And those needs include housing, food, clothing, education, and access to medical care. Most of the time, children who are neglected feel like they are forgotten and like they aren't cared about anymore. Preventing child abuse and neglect, you can strengthen economic supports to families, change social norms to support parents and positive parenting, provide quality care and education early in life, enhance parenting skills to promote healthy child development, and intervene to lessen harms and prevent future risk of child abuse and neglect. A few child abuse statistics are at least 1 in 7 children have experienced child abuse and or neglect in the past year. In 2018, nearly 1,770 children died of abuse and neglect in the United States alone. Rates of child abuse and neglect are 5 times higher for children in families with low socioeconomic status compared to children in families with higher socioeconomic status. About 1 in 4 girls and 1 in 13 boys experience child sexual abuse at some point in childhood. And 91% of child sexual abuse is perpetrated by someone the child or child's family knows. Moving on to elder abuse, there are 5 types. The first 3 are physical, sexual, and emotional abuse. And physical abuse is when an elder experiences illness, pain, injury, functional impairment, distress, or death as a result of the intentional use of physical force. Sexual abuse involves forced or unwanted sexual interaction of any kind with an older adult, and emotional abuse refers to verbal or nonverbal behaviors that inflict anguish, mental pain, fear, or distress on an older adult. The other 2 types of elder abuse are neglect and financial abuse. Neglect is the failure to meet an older adult's basic needs. Just like children, they feel like they are forgotten or not cared about anymore. And financial abuse is the illegal, unauthorized, or improper use of an elder's money, benefits, belongings, property, or assets for the benefit of someone other than the older adult. And most of the time, it's by someone they know, and they typically don't know what's even going on. Preventing elder abuse, professional awareness campaigns to help healthcare workers recognize elder abuse, because a lot of times they won't realize that other healthcare workers or their caregivers are abusing their elder patients. And then caregiver support to reduce stress and caregiver training on dementia, because a lot of times these caregivers are thrown into these situations and they are under a lot of pressure and don't know the proper way to take care of them. And then residential care policies to define and improve standards of care. Collaborate with other sectors to address elder abuse, such as criminal justice, health, and social services. raise awareness within the health sector and other sectors about the health and social burden of elder abuse, recognize elder abuse as a public health problem and establish a focal point to address elder abuse. A lot of times, elder abuse cases go unnoticed or not reported. And then another way to prevent elder abuse is to develop and test evidence-based interventions to prevent elder abuse and provide services to victims of elder abuse. Some statistics of elder abuse include abuse is experienced by about 1 in 10 people aged 60 and older who live at home. In the U.S. alone, more than 500,000 reports of elder abuse reach authorities every year, but millions of more cases go unreported. And in about 60% of elder abuse and neglect incidents, the perpetrator is a family member, and only 4% of elder abuse is reported. And 2 out of 3 people with dementia have been abused. So why do you guys think such few elder abuse cases are reported? And what do you think we can do as a society to encourage them to report more? Here are my references, and thank you guys for listening.